Welcome to the Healthy Pantry. Today, we're diving into a common issue that many of us experience: phlegm buildup in the throat and the annoying urge to clear it. Stick around as we explore effective strategies to tackle this discomfort and restore clarity to your throat. Let's get started. First and foremost, let's have a closer look at what phlegm is. Phlegm is a thick, viscous substance produced by the mucous membranes in the respiratory system. It consists of mucus, immune cells, and foreign particles such as bacteria, viruses, and dust that are trapped and cleared from the airways. Phlegm serves as a protective mechanism to help trap and remove potentially harmful substances from the respiratory tract, preventing them from reaching the lungs. It can vary in color, consistency, and amount depending on factors such as hydration, underlying health conditions, and environmental factors. When produced in excess or becomes thick and difficult to clear, it can cause symptoms such as coughing, throat irritation, and nasal congestion. Excess phlegm can be caused by various factors, including viral or bacterial infections such as the common cold, flu, bronchitis, or pneumonia can lead to increased production of mucus as the body's immune system responds to the infection. Allergic reactions to airborne particles such as pollen, dust, pet dander, or mold can trigger inflammation in the respiratory tract, leading to excess mucus production. Exposure to irritants like cigarette smoke, air pollution, chemicals, or strong odors can irritate the respiratory passages and stimulate mucus production as a protective response. When excess mucus from the sinuses drips down the back of the throat, it can cause throat irritation and lead to the sensation of excess phlegm. In asthma, inflammation and narrowing of the airways can result in increased mucus production, leading to symptoms such as coughing and wheezing. Chronic conditions such as chronic obstructive pulmonary disease, cystic fibrosis, or bronchiectasis can cause persistent mucus production and difficulty clearing it from the airways. What's more, acid reflux from the stomach into the esophagus can irritate the throat and trigger excess mucus production, leading to symptoms such as throat clearing and a sensation of phlegm in the throat. Now let's talk about basic ways to help get rid of excess phlegm. First and foremost, staying hydrated is crucial for managing excess phlegm because it helps keep the mucus thin and more manageable. When you're adequately hydrated, the mucus in your respiratory system remains more fluid. This thin consistency makes it easier for your body to expel the mucus through coughing or swallowing, reducing the feeling of congestion in your throat and chest. Dry air can irritate the respiratory passages and lead to increased mucus production as a protective response. Drinking enough fluids helps to keep the respiratory passages moist, reducing irritation and inflammation in the airways. The respiratory tract is lined with tiny hair-like structures called cilia, which help move mucus and trapped particles out of the airways. Adequate hydration supports the function of these cilia, facilitating the movement of mucus up and out of the respiratory system. Dehydration can lead to thicker and stickier mucus, making it more difficult to expel from the airways. By staying hydrated, you help prevent dehydration and maintain the optimal consistency of mucus for effective clearance. Next up, using a humidifier is a helpful strategy for managing excess phlegm because it adds moisture to the air, which can help alleviate dryness in the respiratory passages and facilitate mucus clearance. Dry air can exacerbate respiratory symptoms and lead to irritation in the throat and nasal passages. By using a humidifier, especially in dry or heated indoor environments, you can increase the humidity levels in the air, providing relief from dryness and promoting comfort in the respiratory tract. Dry air can cause the mucus in your respiratory system to become thick and sticky, making it more difficult to clear from the airways. When the air is adequately humidified, the mucus remains more fluid, allowing it to be expelled more easily through coughing or swallowing. Did you know that steam inhalation is a simple and effective method for managing excess phlegm because it helps to moisten and loosen mucus in the respiratory passages, making it easier to expel? Inhaling steam from hot water creates moisture in the respiratory tract, which helps to hydrate the mucous membranes lining the throat, nose, and lungs. This moisture can alleviate dryness and irritation in the airways, providing relief from discomfort associated with excess phlegm. Inhaling steam can help open up the airways and improve airflow in the lungs. This can be particularly beneficial for individuals experiencing chest congestion or difficulty breathing due to excess phlegm, as it can help reduce respiratory symptoms and promote comfort. But wait, there is more. Gargling with salt water is a simple yet effective method for managing excess phlegm because it can help soothe throat irritation, reduce inflammation, and loosen mucus in the throat. Salt water has antimicrobial properties that can help to kill bacteria and viruses in the throat. Gargling with salt water may help to reduce the growth of bacteria and prevent infections that can contribute to excess phlegm production. You can gargle with salt water several times a day, as needed to help alleviate throat discomfort and promote mucus clearance. Moreover, using expectorants is a common method for managing excess phlegm because they help thin out and loosen mucus in the respiratory tract, making it easier to expel. Expectorants work by increasing the production of respiratory secretions, including mucus, and decreasing its viscosity. This helps to thin out the mucus in the airways, making it less sticky and easier to cough up or expel through swallowing. By thinning the mucus, expectorants make it easier for the body to clear excess phlegm from the respiratory tract. This can help alleviate symptoms such as coughing, throat irritation, and chest congestion associated with mucus buildup. Expectorants can help relieve chest congestion by promoting the clearance of mucus from the lungs and airways. This can improve breathing and reduce discomfort caused by trapped mucus in the chest. By thinning and loosening mucus, expectorants can help reduce the frequency and severity of coughing episodes. This can provide relief from persistent coughing associated with excess phlegm production. It's important to note that expectorants are most effective for managing wet or productive coughs, where mucus is present and needs to be cleared from the respiratory tract. Dry coughs, which produce little to no mucus, may not benefit from expectorant use and may require different treatment approaches. If you have any underlying medical conditions or concerns about using expectorants, consult with a healthcare professional before starting any new medication. Be aware that expectorants may not be suitable for everyone, especially individuals with certain medical conditions or allergies. Additionally, staying active is beneficial for managing excess phlegm because physical activity can help improve circulation, promote mucus clearance from the lungs, and support overall respiratory health. Physical activity, such as walking, jogging, swimming, or cycling, helps increase blood flow throughout the body, including the lungs. Improved circulation enhances the transport of oxygen and nutrients to the respiratory tissues, promoting optimal lung function and supporting the clearance of excess mucus. The respiratory tract is lined with tiny hair-like structures called cilia, which help move mucus and trapped particles out of the airways. Regular physical activity stimulates the movement of these cilia, facilitating the clearance of mucus from the lungs and reducing congestion in the airways. Engaging in physical activities that involve deep breathing, such as aerobic exercises or yoga, can help expand the lungs and improve ventilation. Deep breathing exercises help to mobilize and clear mucus from the lower respiratory tract, promoting effective mucus clearance. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. Lastly, avoiding irritants is an essential strategy for managing excess phlegm because exposure to certain substances can exacerbate respiratory symptoms and increase mucus production. Smoking tobacco is one of the most significant irritants for the respiratory system. Cigarette smoke contains numerous harmful chemicals that can irritate the throat, lungs, and airways, leading to inflammation and increased mucus production. Quitting smoking or avoiding exposure to secondhand smoke can help reduce respiratory irritation and alleviate symptoms of excess phlegm. Air pollution from sources such as vehicle emissions, industrial pollutants, and indoor pollutants, cooking fumes, cleaning products, can irritate the respiratory tract and worsen symptoms of excess phlegm. Minimizing exposure to outdoor pollution by staying indoors during high pollution days and using air purifiers indoors can help reduce respiratory irritation and improve air quality. Allergens such as pollen, dust mites, pet dander, mold, and certain foods can trigger allergic reactions and exacerbate respiratory symptoms, including excess phlegm production. Identifying and avoiding allergens that trigger symptoms can help reduce inflammation in the respiratory tract and alleviate mucus buildup. Respiratory infections, such as the common cold, flu, and respiratory syncytial virus, can exacerbate symptoms of excess phlegm and lead to complications. Practicing good hygiene, such as frequent hand washing, Avoiding close contact with sick individuals and getting vaccinated against influenza and other respiratory viruses can help reduce the risk of respiratory infections and associated mucus production. Did you know that there are several herbs traditionally used to help manage excess phlegm and promote respiratory health? Licorice root has expectorant properties, meaning it helps to thin mucus and promote its expulsion from the respiratory tract. It also has soothing properties that can help relieve throat irritation and inflammation. Ginger has anti-inflammatory and expectorant properties, making it useful for relieving respiratory congestion and promoting mucus clearance. It can be consumed as a tea or added to dishes for its flavor and medicinal benefits. Thyme contains compounds such as thymol that have expectorant and antimicrobial properties. Thyme tea or steam inhalation with thyme essential oil can help relieve congestion and support respiratory health. Peppermint contains menthol, which has a cooling and soothing effect on the respiratory tract. Peppermint tea or steam inhalation with peppermint essential oil can help relieve nasal congestion and promote mucus clearance. Eucalyptus contains cineol, a compound with expectorant and decongestant properties. Inhalation of eucalyptus essential oil vapor can help relieve respiratory congestion and promote easier breathing. Marshmallow root is known for its soothing and demulcent properties, which can help relieve throat irritation and inflammation associated with excess phlegm. It also has mild expectorant effects. Fenugreek seeds contain mucilage, a gel-like substance that helps soothe irritated mucous membranes and promote mucus clearance. Fenugreek tea or gargling with fenugreek water can help alleviate throat discomfort and promote respiratory health. These herbs can be used individually or in combination to prepare teas, infusions, tinctures, or steam inhalations for managing excess phlegm and supporting respiratory health. It's essential to consult with a healthcare professional or qualified herbalist before using herbs, especially if you have any underlying health conditions or are taking medications, to ensure safety and effectiveness. And that's a wrap on our journey through managing phlegm buildup in the throat and finding relief from those persistent throat-clearing moments. Remember, these tips are here to lend you a hand whenever you're feeling a bit phlegmy. If you found this video helpful, don't forget to like, subscribe, and share it with anyone who could use a little extra help clearing the airways. Here's to a throat-clearing free day ahead. Take care and breathe easy, friends. See you tomorrow in the next video. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.